Okay, so today we're diving into something pretty important,
Yeah.
the impact of climate change on our health.
Uh-huh.
I've been looking over all the research and articles you sent over,
Right.
and wow, there's some pretty alarming stuff in there.
Yeah, it is a bit of a wake-up call.
It is. It is.
And you know what's really interesting is just how much we're still learning
Yeah.
about how climate and health are connected.
Yep.
It's
Yeah.
not just like the big obvious things like hurricanes and floods, but like these smaller, more subtle changes
Right.
that can be just as dangerous.
Yeah, absolutely. Well, let's start with something that's been on everyone's minds, especially with this past summer.
Mm-hmm.
Heat.
Yeah,
I mean, you sent over this article about agricultural workers in California
right.
and the increasing risk they're facing from heat stroke.
Yeah, and that's a really serious problem.
It is.
One of the studies you sent over, I think it was from Stanford,
Right.
said that even just a small increase in average temperatures, like 2 degrees Celsius, can really reduce the number of hours
Wow.
that people can safely work outside.
Yeah.
I mean, that has huge implications for people's health, but also like economically.
Right. Yeah. I hadn't even thought about that, the economic side of it.
Oh, yeah.
And, speaking of impacts that maybe we don't think about as much, one of the research papers you sent
Yeah.
was talking about the link between heat and cardiovascular health.
Oh, great.
And it was saying that even being exposed to heat for a short period of time
Uh-huh.
can actually trigger heart attacks and strokes.
Yeah, and that's especially true for people who are already vulnerable.
Oh, wow.
Yeah, so like people with underlying health conditions.
So how does that work? Like, how does the heat affect your heart?
Well, it's not really just the heat itself.
Okay.
It's more how our bodies react to it. So
Okay.
like when you get overheated, it stresses your heart,
Right.
makes your blood pressure go up, increases your heart rate.
And that can be really dangerous.
Yeah, especially if you already have a heart condition.
It's like climate change is setting off all these chain reactions in our
Yeah,
bodies.
exactly.
Okay, let's move on to something else.
Sure.
You also sent me some stuff about vector-borne diseases,
Yeah,
which honestly kind of freak me out.
I get that. Yeah.
You know, like mosquitoes and ticks
Right.
spreading all these diseases.
Mm-hmm.
You sent over a report on the spread of dengue fever,
Right?
and it was talking about how it's showing up in places that have never had to deal with it before.
Yeah.
I think there was an example about an outbreak in Nepal
Yeah.
in a mountainous region that was usually too cold for mosquitoes.
Exactly. So, it used to be that these diseases were kind of limited to certain areas,
Right.
but with climate change, they're able to spread to new places.
It's like they're jumping around as the planet warms.
Yeah, exactly.
And earlier you were talking about how there are a lot of indirect impacts from climate change on our health.
Mm-hmm.
I feel like this is a perfect example, right?
It is. It is, yeah.
It's not just about getting bitten by a mosquito.
Right.
It's the fact that healthcare systems get overwhelmed.
Right.
People have to miss work.
Uh-huh.
And then there's just the constant fear of getting infected.
Yeah.
Okay, so speaking of indirect impacts, let's talk about water.
Okay.
The last group of sources you sent over
Huh.
all had to do with water.
Right.
And I remember reading this article, I think it was from The Guardian,
Uh-huh.
talking about how climate change is making both floods and droughts more common.
Right.
And that just seems crazy to me. Like, how can both be happening at the same time?
It's a bit of a paradox, yeah.
It is?
But basically what's happening is climate change is messing with the water cycle.
Okay.
And so in some places, you're getting way too much rain.
Yeah.
And in other places, you're not getting enough.
Right.
And both situations can be really bad for our health.
Right. So we've got the World Health Organization predicting that by 2025,
Mm-hmm.
billions of people could be dealing with water scarcity.
Yeah, it's a real problem.
And that leads to a higher risk of diseases like cholera and typhoid.
Right.
And then on the other hand, you've got flooding, which can also contaminate water supplies.
Yeah.
And it creates the perfect breeding ground for insects that spread disease.
Mm-hmm.
So it's kind of a lose-lose situation.
Yeah, it is.
One of the studies you sent over looked at what happened after Hurricane Harvey in Houston.
Oh, right.
And there was a huge increase in waterborne illnesses
Yeah.
in the months after the hurricane.
Yeah, and that just goes to show how these climate-related disasters
Mm-hmm.
can have these long-term impacts on people's health.
Wow, we've covered a lot. And I have to say, it's a little overwhelming.
It can be.
So what's the one big takeaway you want to leave our listeners with?
I think the most important thing to remember is that climate change isn't something that's going to happen in the future.
Right.
It's impacting our health right now
Yeah.
in ways that we might not even realize.
Yeah, that's true.
But the good news is that there are things we can do about it.
There are. Like both individually and as a society.
Yeah, there are things we can do to reduce these risks.
Okay.
And one thing that really stood out to me while I was reading through all the stuff you sent over
Yeah.
was how important it is to build more resilient healthcare systems.
Okay. So what does that mean? What does that look like?
Well, for example, we could invest in early warning systems for heat waves
Okay.
or mosquito control programs in areas where dengue fever is spreading.
Right.
I mean, we can't just stop climate change overnight,
Right.
but we can be prepared for the impact it's going to have on our health.
Yeah, absolutely.
So, thinking about all of this, has anything sparked an idea for you?
Hmm.
Like maybe a local organization you could support, or
Yeah.
even just something you could change in your own life.
Yeah.
Just something to think about.
Yeah, I like that. Food for thought.
Mm-hmm.